Morning to all. Today we are going to discuss about cardiogenic shock. Cardiogenic shock is a condition in which a heart suddenly can't pump enough blood to meet the body's need. The incidence of cardiogenic shock. Cardiogenic shock occurs as a serious complication in 5 to 10% of patients hospitalized with acute myocardial infarction. Mostly nearly 80 to 90% of the patient used to develop mortality rate, but the rate has now dropped due to advent of thrombolytics and other interventional procedures. Incidence of cardiogenic shock is more common in men than in women due to the higher incidence of coronary artery disease. The risk factors are old age, have a history of heart failure or heart attack, have blockages in the coronary artery, mostly in the heart's main artery, then diabetes, high blood pressure, then existing heart disease are the major risk factors. Next, we can see the causes of this particular condition: myocardial ischemia, myocardial infarction. So, myocardial ischemia causes high demand of oxygen. Then, myocardial infarction increase the cardiac output. Other possible causes of cardiogenic shock include inflammation of the heart muscle, this myocarditis, endocarditis, infection of the heart valves, weakened heart from any other causes, then drug overdose. Next, we can see the classification. The classification of coronary cardiogenic shock. First one is coronary cardiogenic shock is more common than non-coronary cardiogenic shock, is seen most often in patients with acute myocardial infarction. Non-coronary cardiogenic shock is related to condition other than the cardiac causes, mostly that cause stress to the myocardium. Symptoms are clammy skin, decreased systolic blood pressure, tachycardia, rapid respiration, oliguria, cyanosis, mental confusion, rapid breathing, severe shortness of breath, sudden rapid heartbeat, that is tachycardia, loss of consciousness, weak pulse, hypotension or low blood pressure, sweating or diaphoresis, pale skin, cold hands or feet, urinating less than normal or sometimes not at all urinating. Next, we can see the pathophysiology of cardiogenic shock. Inadequate perfusion causes cell hypoxia that leads to energy deficit. Due to that, what happen means the lactic acid may accumulate inside and causes anaerobic metabolism and leads to fall in the pH. So as a result, metabolic acidosis happens and this leads to vasoconstriction, failure of precapillary sphincters and causes peripheral pooling of blood. As a result of metabolic acidosis, cell membrane dysfunction and failure of sodium pump occurs. This leads to intracellular lysozyme release, digestive enzymes, intracellular release of lysozymes as well as digestive enzymes that causes efflux of potassium as well as influx of sodium and water, leads to toxic substance which may enter into the circulation. As the toxic substance enter the circulation, capillary endothelium may get damaged and causes destruction, dysfunction and cellular death of the heart. So that's all about the pathophysiology. Diagnostic measures of cardiogenic shock are physical examination, history collection and chest x-ray. Other investigative measures are ECG, echocardiogram, cardiac catheterization or angiogram. Next, we can see the preventive measures. So to prevent cardiogenic shock, advise the person not to smoke and to avoid second-hand smoke. Maintain a healthy weight. eat less cholesterol or less fat-rich diet, limit more sugars and alcohol, exercise regularly. Treatment is mainly concentrated on the patient condition. So based on the patient condition, if the patient needs emergency life support, means immediately initiate this emergency life support. Vasodilators, these drugs act as the blood vessel dilators like nitrates. Then beta blockers, example propranolol. Calcium channel blockers, example nifedipine or verapamil. Thrombolytic drugs, example streptokinase or urokinase. So before administering thrombolytic drugs, we should note the criteria whether the patient is eligible to get the thrombolytic drugs or not, and after that only we need to administer the thrombolytic drugs. And why means the patient may used to develop severe complications. So before administering thrombolytic drugs, we need to note whether the patient is eligible to receive this thrombolytic drugs or not. Then antiplatelet medications in order to remove the clots. Next is the medical procedures. So what are the invasive procedures we can do to this particular patient? Means angioplasty after confirming whether there is any block in the particular patient coronary artery, and after angioplasty we can do even stenting also to prevent further blockage. Angioplasty for coronary artery disease. Then balloon pump, intra-aortic balloon pump is another procedure to help the patient to save the life. So this is the procedure which we used to do as a intra-aortic balloon pump procedure. Next is the surgery. The surgery which commonly used for this particular procedure is coronary artery bypass grafting, CABG. Then heart transplantation. So before doing this procedure also we need to have a donor. Then ventricular assist device is a mechanical device implanted into the abdomen and attached to the heart to pump the ventricles. This might extend and improve the life of the particular patient during the end stage heart failure. This is the ventricular assist device. Next is the nursing management. So based on the patient needs, we need to provide nursing care to the patient, assess the patient condition, assess the patient vital signs, especially blood pressure, note whether the patient is having any fluid overload, monitor the fluid of the particular patient. The ventricles of the heart cannot fully eject the volume of the blood at systole, so fluid may accumulate in the lungs. This is a serious complication. The person used to develop mostly pulmonary edema is the most complication that used to develop due to fluid overload. So based on the patient complaints, we need to frame the nursing diagnosis. Impaired gas exchange related to decreased blood flow as evidenced by breathlessness, acute pain related to disease condition as evidenced by patient verbalization, impaired physical mobility related to weakness as evidenced by patient is unable to perform daily activity, imbalanced nutrition less than body requirement related to less intake of food as evidenced by weight loss, disturbed sleep pattern related to hospitalization as evidenced by patient verbalization. So that's all about cardiogenic shock. So hope you all understood the particular condition. Thank you.